Hi, and welcome to Chapter 15 with mental disorders. Couple of things here before we get started. The chapter overview for this section is great, so make sure you read through that. It just kind of gives you a little bit definitions of some different mental disorders themselves. Couple other things, terms to know: abuse is problematic use of drugs or alcohol, but without dependence. Okay, that's important for this section. And then dependence is you have an increased tolerance to drugs, alcohol, without a compulsion to continue taking the substance despite the cost. Again, withdrawal symptoms could happen in this type of scenario. All right, so let's go ahead and get started. This chapter isn't going to take us long to run through. With mental disorders, one FYI, a lot of these codes, like a psychiatrist, they pull these from a different type of coding nomenclature book, which is called a DSM. And most of these codes are used as the same as ICD-10 codes, but the terminology may be somewhat different. And what I mean by that is that they explain the definition of the problem out much better than what ICD-10 does. Okay, so here, these are just talking about different mental disorders. Okay, so the different disorders, just make sure you look through them. It tells you how to, again, with this point, I'm not going to go into the coding. You should be, getting used to the code book, looking things up. Make sure you go through these slides. We have dementia, okay? With dementia, we are in category F03.9, and here it's just with behavioral disturbance without. Okay, so again, dementia, we have a lot of different things that defines that, so make sure you review those. We have altered mental state, and you're going to see a lot of R codes, so keep that in mind. Schizophrenia, F20 codes. Again, what type did they have? So again, make sure you look close enough. Same thing with your affective disorders. We have major depressive disorders, bipolar, non-psychotic, okay? So again, anxiety. Again, just read through your documentation is the biggest thing, and make sure you go far enough and code it appropriately. Dissociative and conversion. All right, so let's kind of move on here. We want to get into substance abuse, okay? Again, abuse codes are assigned for mild substance use disorder, dependence, moderate or severe use disorder. If you have alcohol dependence and abuse, keep in mind, just because you abuse alcohol does not always determine that you are dependent on it. Okay, so keep that in mind. Okay, so what's the difference here? So again, alcohol dependence is differentiated from alcohol abuse by if they have presence of symptoms of tolerance or withdrawal, then we're looking for alcohol dependence. Okay, another thing in this chapter, look at Y90. Okay, this could be for blood alcohol level. If they give that to you, you need to code it. Just other things we have, subcategories: presence of intoxication, delirium. They have for drunkenness, we have in remission, and it has to state remission. You just can't assume because they didn't have alcohol for a week or two. Okay, it has to be, again, the doctor has to state in documentation. And here again, drug dependence and abuse, it goes by the drug. Okay, you can see these are not T codes. They're coming right from this chapter. They're F codes. All right, so with that, again, if there's any withdrawal, you have to code that withdrawal code. And there is going to be procedure codes for withdrawal too. Okay, so I am going to, with a selection of principal diagnosis, when a patient, again, is admitted for detox or rehab for both drug abuse or dependence and alcohol or abuse or dependence, both are treated. It does not matter which one you designate as principal diagnosis. Okay, so go ahead, follow through the guidelines. We have therapy with these. they're going to be, our first character is going to be G and H. Okay, so mental health or substance abuse treatment. So placeholder, second character. We have third character, which is a root type, only 12 values. And then here's an example, crisis intervention. As you can see here, we have G72ZZZZZ. Okay, root type values and mental health section. We have all of these. So again, they said there's only 12. And procedure coding for substance abuse. Okay, so second character is a placeholder again, and then these are going to be your root operation. These procedures are very easy, super easy to code. Okay, if anybody has any questions on this chapter, send me an email.